been doing this a very long time, and I've told lots of family members over the years that their loved one is not going to come home. And COVID has been completely different. It is so much more emotionally draining. And I don't know if it's because a lot of these people were pretty healthy before they came in, and so it's very unexpected for them and unexpected for the family members. I know that our patients are a lot younger this time with the second wave. We see a lot more middle-aged 30 to 40-year-olds. That's one of the questions that they always ask is, how long am I going to be on the ventilator? And we have to tell them, like, it's going to be weeks. COVID is not something that turns around quickly. They stay on it for a long time, and it puts such a hard strain on their body and their family members and on us as caregivers. They know what a coma means. They know what a medically induced coma means. And they know that there's a good chance that they're not going to wake up from it. And one of the things that they always want to do is, even though sometimes they can't even talk because they're so out of breath, is they want to FaceTime their family members. And probably just in the last few weeks, we've had 30 to 40-year-olds that are possibly saying goodbye to their children, their 5-year-old at home. And that's kind of the process that we go through with almost every single intubation. So whether they're young or old, they're always saying bye to somebody. We know the effects that it's putting on their body being on the ventilator for that long. They lose muscle tone, they lose the ability to even lift their arm up off the bed. A regular ICU patient that's on the ventilator for a few days does not have to learn to walk again. A COVID patient does. They have to start over from scratch a lot of times. And a lot of times they're starting over from scratch at 70 years old. And sometimes a 30-year-old is having to learn to feed himself again because they're on the ventilator for that amount of time, that long period of time. Being that lifeline for them, because they can't come up here and see the patient, they can't see their family member, it kind of helps us deal with it a little bit, because we're helping them in some way by being that line of communication between the two. I don't know if I am coping with it well. Today was one of those days. I kind of just floated around and helped people, and on one side of the unit, somebody got extubated, and all you could hear off the iPad was tears of joy from their family members getting to see them without the tube in their throat. And they've been intubated for 3 weeks now, and this is the first time their family has seen them awake. And then you go down to the other unit and you hear people crying because their dad just died. So it's those nurses taking care of those patients are going to have 2 very different days, and they are going to go home with 2 very different mindsets. And sometimes you're just glad that it's over and that you get to go home and not think about it anymore. And even our family, when we go home, they don't get it. They try to, but they don't understand what putting people in a body bag feels like before they walk through the door to see their kids. They don't have to go through that emotionally before they come home. So it's always been stressful working in a hospital, working in the critical care unit, and these are truly my brothers and sisters here because of that. But COVID has really bonded us because everybody's just so stressed out. And when this second wave hit and we started getting all of these unvaccinated people that are dying, and it could have been prevented. If they'd have gotten the shot, they would be at home with their family and not in our morgue. If you are considering vaccination, I would talk to your doctor, I would talk to your family, I would talk to somebody that you know in the healthcare system, because they are going to give you a straight answer that the vaccine is keeping people alive. They're keeping people out of the hospital. And it's not so much as keeping people from spreading it to other people, it's about you not winding up on a ventilator.